Good morning, folks. Thank you for coming together here for the Lifesavers conference and for participating in this particular workshop. This is in slot 4 of the workshop series, and the title of the workshop is The Role of Policy and Enforcement in Traffic Safety Outcomes. I'm Shashi Nambisan. I'm a professor at the University of Nevada, Las Vegas, and I lead the Transportation Research Center there. And I'm delighted to serve as the moderator, chair, or facilitator of this particular session. We have an exciting set of speakers lined up for the workshop, and we'll get to that in just a minute. But I also want to acknowledge and thank all the sponsors, exhibitors, of the Lifesavers conference that makes it possible for us to host the event and keep the cost of attendance reasonable for attendees. So thank you to all sponsors and exhibitors. I also want to recognize and thank people who make this session possible in terms of behind-the-scenes support, the audiovisual. We have Alex up here, Ernie and Pete in the back, so thank you for your support, folks. All right, now for the logistics of the session. We have 2 speakers. Each speaker will have about 25 minutes for their presentations. We will entertain questions for about 5 minutes or so immediately after their presentation. Please make notes of your questions or comments. What we would have after the 2 presentations is, I'll get both the speakers to come up to the top of the podium out here, the dais out here. And then we'd like to have maybe about 25 minutes to 30 minutes of discussions, question and answers. While we have speakers who bring tremendous amount of experience and expertise, I believe that we all learn from each other. It's not a one-way street, it's a two-way street. So engaging in the conversations or discussions, we would love to learn from members of the audience about your relevant experiences and feedback to the 2 speakers. Any questions, comments, concerns about how the session will be? If you have no questions, no concerns, no comments, please raise your right hands. Just keep you awake. The other right hand. Yeah. Okay. If you have any questions or suggestions how we might run the session, please raise your left hands. No. Okay. Hearing none, so let's get going with the show. It's 5 minutes past the hour, and we are on schedule. The first speaker is Dr. Joyce Pressley, a good friend who I've known for many years. She is a faculty member in the Epidemiology and Health Policy Management program at Columbia University in New York. She has worked in traffic injury prevention and in a number of areas, including chairing, being the most recent role as the chair of the TRB, Committee on Occupant Protection, for 6 years until April of last year. Her expertise, interests, experience include transportation safety, injury prevention, disparities and inequities in the scale-up of known or proven countermeasures that could help improve traffic safety. She's also active outside of TRB in a number of other areas such as APHA and the Savers Council of Centers, and she's a recipient of the Savers President's Award. So please join me in welcoming Joyce.
Thank you so much, Shashi. Good morning. Thanks for coming out so early in the morning. I'm glad to see so many friends here. Today, we're going to talk a little bit about the role of policy and enforcement in traffic safety outcomes, with most of my examples and work being out of New York State. So we'll briefly review several studies that we've performed through the years that provide varying levels of evidence that policy and enforcement exert an influence on motor vehicle occupant injury and mortality. We're going to look very briefly at 6 studies here. traffic deaths and serious injury during high visibility enforcement, or the click it or ticket program as it related to New York State, teen occupant mortality under GDL in primary and secondary enforcement states. We're also going to look at the New York City pediatric taxi injury and related TBI injury before passage of the restraint law that applies to vehicles for hire in New York, serious injury and various levels of ticketing for impairment across New York counties, and changes in local and state trafficking pre-COVID and during the COVID era, and factors associated with shifts in mortality in New York State before and during the COVID era. New York was sort of the epicenter of COVID, and I think it impacted our traffic as much as any other state. So for the Click It or Ticket program, we looked at it in upstate and Long Island. We did not look at New York City because there were numerous Vision Zero activities going on there, so we limited it to the counties outside of the 5 boroughs of New York City. The fatality analysis reporting system was analyzed for the pre-COVID years. We used public use data from NHTSA for FARS. We used a census of all crashes on U.S. roadways involving a fatality, and then we looked at 3 periods of enforcement. Pre-enforcement, January 1 to the begin date of the high visibility enforcement, peri-enforcement from day 1 of the high visibility to August 31st, and then September to December. We looked at mortality in vehicles that were passenger vehicles, passenger cars, SUVs, vans, and pickup trucks. This is what that looked like across those 3 enforcement periods. You can see that overall mortality was lower during the enforcement period. Both drivers and front seat passengers had significantly lower mortality peri-enforcement than either pre or post. In adjusted analyses, fatality was 30% lower during the peri-enforcement compared to either pre or post. These declines had us scratching our head because we saw them in unrestrained, restrained, and those who were missing restraint status. So this is what that looks like in terms of the lowered mortality by restraint status. You can see that it's lower in the green bars across all 3 periods. This is, so we started looking at the fact that people maybe don't know that the blue lights out there are for seat belts, and that maybe they work and manage their other risky driving behaviors. And what we saw is that there were lower speeding related crashes that were fatalities, and there were drinking and impairment was lower during the enforcement period than the other periods. So this shows what we controlled for to get that 30% lower mortality rate. So we adjusted for the factors seen here. Adjusted mortality was higher in crashes that were rural, alcohol involved, and speeding involved. So high visibility enforcement impacts multiple risky driving behaviors and had a significant effect on motor vehicle mortality. Despite the targeted time frame for click it or ticket being daytime, a larger effect was actually seen in the areas we looked at in New York State at night. Mortality was lower across restraint status in the light of lower fatal speed involved and alcohol involved crashes. We also, this is a second study, we looked at teens and teen restraint status, again looking at fatal crashes using FARS data in states that had secondary law or primary law. What we saw is that, I'll show it to you on the next slide, restraint use in teens covered by a secondary law rises to the level of primary coverage while they're under GDL. However, in the secondary law states, restraint use declines once the teen is no longer covered by GDL. We had hypothesized that teens covered by GDL might remain and have those habits continue, but they did not. While teens in a primary law state retained the level of restraint use exhibited under GDL. So this is what that looks like here. You can see at age 16 in that yellow line where representing the percent belted in fatal crashes under a secondary law state, it rises to the level of the green, which is the primary law state, and then it falls back down significantly below those of the primary state. This is a third study. We looked at New York City pediatric patients being transported in a taxi versus a private vehicle to a New York State hospital following a motor vehicle crash. Passengers aged less than 16 years in private vehicles were covered by a primary restraint law, while those in New York City taxis were exempt. Private vehicles require child restraint use for infants and small children, and taxis do not. Restraint use was analyzed using New York State codes data for private vehicles versus taxis, and this is before passage of our near universal restraint law. We actually used some of these studies when we educated our legislators who were going to make a decision. In the 12th year, we had 11 years of failure of attempting to educate our legislators on the importance of universal seatbelt law. Unrestrained taxi crashes had approximately a 45% higher TBI compared to private vehicles. The number is low, but still significantly different. Unrestrained taxi passengers had 2.5 times higher TBI than taxi passengers. This is what that looks like. This is actually the citation at the bottom is the citation of the publication for this. But you can see that in a taxi, both belted and unbelted children had higher injury. And this is looking at the percentage of pediatric crashes with TBI by belt status. You can see here that for the unbelted, it's significantly higher than for the private passenger vehicles. So New York passed a groundbreaking primary rear seatbelt law that was effective during the pandemic era of low enforcement. This passed in October of 2020 and was signed into law on November the 1st, but for effective November the 1st. Before this law, we saw that front seat restrained passengers in New York State had lower mortality than did and lower severe injury than did rear seat unrestrained. And again, we use this to educate our legislators. We also looked at alcohol-involved crashes by ticketing by county characteristics. And this again uses some of our New York State codes data. The alcohol-related motor vehicle crashes declined in the 3 geographic regions of New York State over the past few decades. The regions differ in the degree of decline, with the counties outside of New York City showing smaller declines than the city where public transportation is readily available. The largest declines have been observed in the more urban areas of New York City, where private taxis, livery ride-hailing services, and affordable public transportation alternatives are readily available. The smaller declines have been observed in Long Island, with the very smallest observed in upstate. Upstate, defined here, is the New York State counties outside of New York City and Long Island. The upstate accounts for 40% of our New York State population. It has 51% of our New York State licensed drivers, but it has 59% of our injurious alcohol-related driving crashes. So this is what it looks like by county. You can see that the Long Island in the southern right-hand area here has lower mortality. The red areas are the areas of highest mortality, alcohol-related injury rates and serious injury rates per 100,000, with the low being the green and medium being yellow. So alcohol-related motor vehicle crashes were inversely associated with transportation availability in upstate and Long Island, New York. They had significantly fewer taxi licenses per 100 population, and the taxi licenses per road mile were also significantly lower. There have been previous reports in the literature that increased numbers of alcohol-serving establishments results in higher alcohol-related injury. That's not what we saw when we looked at upstate and Long Island in New York. On-premise alcohol outlets, such as bars and restaurants per road mile, and off-premise alcohol outlets, such as liquor and convenience stores, were all significantly lower in the high alcohol-related injury areas. We hypothesized that that is related to people having to drive further on rural roads and in the upstate on two-way traffic roads after they have visited a restaurant or a bar. This is looking at those individual counties plotted with the alcohol-related motor vehicle injury on the y-axis and the alcohol-related motor vehicle citations on the x-axis, on the horizontal axis here. You can see that we have a collection in the A quadrant on the upper left where we have high alcohol-related injury, but we have low alcohol-related citations. So we questioned as a policy decision if we could increase our alcohol-related motor vehicle citations, would those injurious counties shift laterally over and keep the same amount of injury, or would they fall to area E here or even to area F, having lower injury alcohol-related if they increased their ticketing and their surveillance for impaired driving. So in conclusion, this study was conducted while ride-hailing services were illegal in upstate. Compared to counties with low alcohol-related motor vehicle injuries, those with medium to high alcohol-related motor vehicle injury rates were more rural. They had lower median incomes. They were less likely to be adjacent to a metropolitan area. They had fewer alcohol establishments per road mile and fewer licensed taxi cabs. Ride-hailing services have since been legalized in all jurisdictions of New York State. I'm going to look now, share some work with you that is to be published. This was done by a student worked with me, Sydney Music, on her practicum and her thesis in the Department of Epidemiology. She looked at trends in motor vehicle traffic ticketing in New York State during the COVID era. We built a New York State county level data set containing monthly data 2019 through 2021. We got that from the New York Department of Motor Vehicles. We looked at yearly ticket subcounts across moving violations. We also looked at yearly injury and fatality counts, which we got some from DOH, some from ITSMAR, and from FARS. We looked at national COVID-19 incident cases and deaths, and we also looked at New York State incident cases and deaths. The counts of national news reports on police events, such as the death of George Floyd and the trial of Derek Chauvin and a few others. We looked at counties by the percent of non-white residents and also looked at several other county-level characteristics that we had previously compiled in a database. So we've been tracking motor vehicle ticket in New York State since 2014. It was reported to have decreased significantly in 2020 in New York State in the wake of increasing motor vehicle traffic deaths. Specifically, we examined monthly trends in county-level motor vehicle citation patterns by COVID cases and COVID mortality. The COVID mortality was predictive, the cases were not. And we looked at county-level race and ethnic distributions and annual county-level motor vehicle crash injury and fatalities. So this is looking at the enforcement for moving violations issued in New York State by month for calendar years 2019 and 20. You can see on 2019 is pre-COVID, and as we hit COVID, you can see as it starts to ramp up in March and April, our ticketing goes down and it does not come back up. This ticketing was influenced differently by state police and by local police. So this is what it looks like. The darker blue line on the top there is the local police 2019 average. And then you can see the other line that dips in the dark blue in April of 2020 and comes back up, but it never approaches what it was in 2019. When we look at the state police, that's the light blue horizontal line is their average in 2019. And you can see that they dip significantly during April and the initial part of COVID, and then it pops back up and is almost equivalent to their pre-COVID rates. This is looking at tickets issued per percent residents of color. What we see pre-pandemic is in that blue line. It's where we see increasing percent residents of color have higher ticketing rates. Once COVID had hit, it evens out and is more equal in terms of the number of tickets given out. However, when we look at mortality, look at injury, at serious injury, the serious injury is significantly higher in those counties with higher percent non-whites. So that has us continuing to look at smaller geographic areas. We have a NHTSA grant to look at this more in terms of equality versus equity. So if we make our tickets equal, is that equitable if those counties and neighborhoods that have high non-white populations are dying or having more serious injury? So we also looked at motor vehicle trends in New York State pre-COVID and in the COVID era. And I'm going to show you just a little bit of this study. It'll be presented more in detail on April 16th at the Society for the Advancement of Violence and Injury Research. So we initially looked just pre and post-COVID, and we went back and redesigned our study and tweaked the time frame so that we have an exact match of the months in study period 1 and study period 2. So pre-COVID, we looked at April 1st of 2018 to December 31st of 2020. And then for the transition period, we looked at January of 2022 to March 31st. That first one should be 2019 and period 1. It's a typo. And we looked at COVID period 2 from April 1st, 2020 to December 31st, 2021. What we see in these identical 21-month periods, pre-COVID and post-COVID, they're matched by month, is we had 1,725 deaths in the pre-COVID period, and this increased during the COVID era to 2010. I'm going to show you just a little glimpse of the factors that contributed to those increases. So this is what that looks like if you look at the pre-COVID, which is in the green dotted line, and the COVID era, which is in the solid purple line. You can see that all but about 4 months are much higher during the COVID era. This is looking at the road user type pre-COVID and in the COVID era. So our percent change in our COVID deaths was 16.5 for total deaths. And the motor vehicle occupant mortality was 19.6. Motorized 2- and 3-wheelers increased significantly, 45%. Our bicycle non-motorized increased at a much smaller proportion, and our pedestrians actually declined. And this is a little caveat. We have a pedestrian report coming out specifically on this, but in New York City, we had a huge shutdown of all the restaurants and the bars, and Broadway was shut down for like more than a year. So we had fewer pedestrians out and about. Once things opened back up, then we do see some of those increases in the COVID era compared to the pre-COVID era. So this is looking at one of the behavioral characteristics that contributed in terms of we had safety equipment not used at 52.7%. Motor vehicle drivers being unrestrained was 39% higher, almost 40% higher during the COVID era. And 2- and 3-wheelers, even though that's a small amount, the proportion who were not helmeted increased significantly from 17 to 57. So in summary, during the COVID era, compared to pre-COVID, New York experienced a significant increase in road traffic deaths. Deaths among road user types shifted during the pandemic. Commonly cited increased risky behavior was only one of several factors contributing to this rise in mortality. There was a lower use of safety equipment, seat belts, and helmets. There was a shift in the types of vehicles contributing to this increase in mortality. Motorized 2-wheeler and 3-wheeler rider deaths increased significantly compared to 4-wheeled occupant deaths. And road traffic fatalities are a significant issue in this population, and it's an emerging issue that should be on our radar. The Biden administration has added $1.9 billion request to the DOT funding for the upcoming year, and the language specifies to increase the rideshare funding and co-funding for cities for shared scooters and mopeds and some of the bikes. For roadways, our urban roadways increased significantly more than those of rural areas. We think some of the studies that we just presented offer clues as to why that happened. I want to give you a funding acknowledgement and a disclaimer. The Centers for Disease Control and Prevention funded the Columbia Center Injury Science and Prevention, some of the work that I did. The Core State Injury Prevention Program, Core SIP, and the Governor's Traffic Safety Committee provided grant support to the New York State Department of Health, Bureau of Occupational Health and Injury Prevention, which funded some of the work that I did on this. The contents of this presentation are those of the author and do not necessarily represent the official views of the funders, nor an endorsement by the New York State Department of Health, the CDC, the GTSC, or the U.S. government. But I might add that about 85% of these slides have been through DOH review, and they co-authored the publications on a lot of them, but there's a rule that we have to put this through the DOT review, and there are a few slides in here that we didn't do that, thus the disclaimer. So this is our team that we're continuing to work with. Thank you very much.
Thank you, Shashi. Thank you, Joyce. And thank you all for coming today. It's great to see some of my old colleagues and friends since COVID starting to get back together and have personal interaction. Is really nice. I haven't been to Lifesavers in a while, so it's good to see you all, and thank you for coming. So I guess I can use this, right, go forward. So I thought it'd be kind of cool to start out with policy and versus law, because this is a policy and law enforcement workshop. So I pulled this really quickly from Cornell Journal of Law, and what the law means and what policy means, and I'm not going to read them, but there's a difference. And policy is the implementation of the law. And for us, that means that we want to enforce through policies the traffic laws to reduce risky driving behaviors and gain compliance with driving within the law, and therefore increasing safety on our roadways. So, Mary Bird and Joyce, Mary Bird works with NHTSA, asked me to look at this and to give a presentation here at Lifesavers about how these policies over the years have helped us reduce crash risk and fatality and injury crashes. So I thought it was a worthwhile effort, and that understanding the difference between law and policy is important. So, I'm going to give you some data today. I'm going to talk a little bit more about COVID from a national perspective and from where I live and what we do in my shop to work with law enforcement to stimulate traffic law enforcement activities. I want to talk about equity and equality a little bit because they're very different things. So I'm sure everyone's seen this graph, and I put a trend line on it because the trends are going the wrong direction even in the last couple of years. We've had some decreases. I think that is doing a great part to the significant increases in VMT post-COVID, and people are getting back out on the roads. So, you can see where the spike happened in 2020 nationally with COVID. We shot up over 42,000 deaths, almost 43,000. And this is very perplexing what happened with COVID. And I'm sure you've heard some of it, but I'm going to give you a little bit more, maybe a different spin on what you've seen before. So, risk-taking significantly increased. And we have a couple reports on NHTSA. There were quarterly reports on the what happened on COVID and how we track these significant increase in impaired driving, drug and alcohol use, occupant protection failures where we had a lot of ejections. So we know that folks were engaging in some really risky behaviors. Those that stayed on the roads, right? Because we had a lot of stay-at-home orders, most people stayed home. So there was this risk-taking community that was out there nationally on the roads and getting in fatal crashes. And I say that for a reason. So this is, and the 2023 numbers are out. Everybody know that. It's the early estimates out, 40,990. And so a little bit of a drop, 2.3% drop. And these are by our NHTSA regions. So you can see that only 2 regions had increases and the remainers had decreases. I know our regional administrators watch this very carefully. So this is a current crash picture. There was 42,000 deaths in 2022, 40,990 in 23. Now that's the projection. That's going to go up a little bit. So we're down 3% again, 3.6% again, which is very good. Not enough because if you looked at the trend line, it's still going the wrong direction. We went a negative slope trend line where I work. And 35 states showed decreases. So good news, I would say, but not great news. And it's the 7th consecutive quarterly decrease, coming out of COVID. So that's a good thing. If you look at the subcategories, and we only have this through mid-year of 2023, you can see that there's increases in rural and local roads across the country. Older populations had increases, and younger populations had increases. That's not surprising, but we would like to push those numbers down. Nice to see speeding come down a little bit, but we're still at historical highs with speeding-related fatalities. Motorcycles came down a little bit, but we're still at historical highs with those. And pedestrians came down a little bit, still at very historical highs with those. So, a one-year decrease doesn't mean a trend. So we're very concerned about these things, even though they decreased a little bit over the years. Now, these next 3 graphs, I think, is what I found very interesting, and maybe you'll find interesting as well. I mean, you can see the spikes the historical trends over time. What I wanted to point out here is I think everybody knows when there's been economic downturns, we've seen downturns in fatal and across the board crashes. People don't drive as much, VMT goes down, people don't have disposable income, so they stay home more. I guess they're a little bit more careful, but everywhere you see these little dips, there was usually an economic impact that precipitated it. So, recessionary times meet with lower numbers of fatal crashes and crashes across the board. And, over here in 2021, you can see the spikes go back up again related to COVID. But if you look at serious injury crashes, spikes aren't nearly as high at that they only have a 2021 there, but the 2021. And then look at property damage crashes. They went down even more. So we had fatal crashes soaring, but injury and property damage crashes has decreased. There was a lot less VMT, right? So it's telling us there's a subset of the population out there that's very high risk and engaged in these high risk driving behaviors. And we don't understand completely why, but we think we have some pretty good ideas. VMT was way down, so congestion was way down. Congestion where I live is probably not a bad thing, right? Because if you're in a significant congestion, there's not going to be any fatal crashes there. Might be some fender benders, but no fatal crashes. Probably not serious injury crashes. But, mobility is a necessary sort of privilege that we have to give to people to get from point A to point B. So I thought these were interesting. So you can see them again. They're high in 21 fatals. They're low in serious injury and even lower in property damage. And then speeding, I threw this in there. We have some new speeding issues. A little surprised there wasn't a lot of speeding sessions here this go around, but speeding is at a historical high. So we do have a new campaign that's out there, and we can talk a bit about how you can leverage that. It's the social norming campaign. We're doing a national media buy every July. It's a research project, a demonstration project, or a pilot to try to understand whether or not this might be helpful in reducing speeding-related crashes, which is a serious issue. So yeah, the data is really wacky with COVID, and we haven't completely understood it yet, but it's not following the normal economic downturn, results that we have seen historically. So I wanted to point out a little bit, so we're talking about law enforcement and policy. So our policy at the DOT is, of course, we're looking for Vision Zero. But I think the statement in the National Roadway Safety Strategy is really important because it really recognizes, despite all the issues that we've been having, that law enforcement and the work of our nation's law enforcement officers are critical to the prevention and reduction of traffic-related fatalities and injuries. And then it has this equity statement in there, and we'll talk a little bit more about that later. But it defines equity as the consistent, fair, just, and impartial treatment of all people. And that's really easy to say, it's easy to conceptualize, but really hard to implement and understand and know if you're doing well in this area. So it's great that this statement's in the NRSS. It's a foundational statement because law enforcement is really going to be helpful to us to getting those numbers back down and moving towards zero. So, in terms of policy, we love research. Joyce, great research. I love reading. I read research reports 2 or 3 a week, probably. So we have countermeasures that work. I think everybody knows countermeasures that work, but I wanted to put that in terms of high visibility enforcement because those are some of the best countermeasures that are in countermeasures that work by the star ratings. So I put them in for each, like the most significant highway safety issues: occupant protection, impaired driving, distracted driving, and speeding. And you can see that the high visibility components in the research and the 5-star or the ratings by stars are some of the best. So we know high visibility enforcement works. And we understand that consistent enforcement across the high visibility mobilizations is even better. But high visibility enforcement is a very specific thing. And you have to follow all the ingredients. So there's a toolkit on our website. We're updating it now to add some community engagement components to it. But there's ingredients to high visibility enforcement. And first and foremost is a communications plan. You have to have the social norming and the enforcement messages that, hey, don't do it because it's bad for you. Hey, if you do it, you're probably going to get caught or you will get caught. And thirdly, there has to be law enforcement out there to catch people. You have to have those 3 ingredients or it really doesn't work effectively. So I think everybody is involved in these issues in your states and local communities, but you have to have those 3 ingredients and they have to follow that order. So you can't do the enforcement piece before you tell the public the enforcement piece is coming. So you do these social norming messages, you do these enforcement messages, and then you do the enforcement. So I'll talk about them in the law in a minute here, but this is the policy, right? This is a good policy statement, even though it's sort of guidance. So it's so important that Congress over the last 3 decades has put it in the law, right? So I don't know if you know this, but all the State Highway Safety Office people here will know that to get federal money, you have to get, the State Highway Safety Office, Mike, has to issue an assurance to NHTSA that they will get the law enforcement agencies in their communities and within their state to engage in the mobilizations, because we do national media buys both for the social norming message and for the enforcement message, and then we expect through the assurance that the state gives us that at least some law enforcement agencies within the state are going to engage in high visibility enforcement implementations around the state. So, and it requires that they have an assurance that they'll have sustained enforcement of statutes addressing impaired driving, occupant protection, and speeding throughout the year. That's, hard to get Congress's attention on a lot of things, but for decades they've had this in Section 402, which is the sort of the general grant funds that NHTSA puts out to the states. Now, I don't know if you know, but there's 18,000 law enforcement agencies in the country. About 17,000 of them do full service work, including traffic enforcement. So, that's a lot of agencies to get touch. 80% of those agencies only have 20 or fewer employees. So there's a lot of very small agencies out there in rural America. Now, 80% of law enforcement personnel work in the 20% of the biggest agencies, right? Like California Highway Patrol and NYPD and some of the bigger cities. That's where most of the law enforcement officers work. But, out in rural America, rural road issues are a real problem. There's many, many thousands of agencies that are very small. Some have 1, 2 people, but they do traffic services. So it's hard to reach them all. But the states do a good job, and they have to agree to work with the State Highway Safety Office to participate in these mobilizations. And I think that's important. Because this high visibility enforcement model truly does work, as you could see by the star ratings from countermeasures that work. That's a great book. It's sort of like the Bible of traffic enforcement and traffic strategies, traffic safety strategies. So does it work? So I like these 2 studies here. I love research. So there was a survey done a few years back that said this is pre-COVID, 61% of American drivers self-reported that they're motivated a lot to practice safe driving to avoid getting stopped and getting a ticket. We know their driving behaviors may not fall in line with what their thinking is, but, they do, that's the general deterrence model, right? Generally deter, people think that if I drive inappropriately or in a risky manner, that I could get stopped and get a fine. So, and this other study said for every 10% reduction in traffic enforcement, it's estimated that fatalities will increase a good bit, 3.3 to 3.8%, and injuries 4.1 to 4.7%. This is a very interesting study. And I think it's proven by what happened during COVID, because there was massive decreases in law enforcement activities that had already started prior to COVID hitting, and then when COVID hit, there was these, social distancing mandates. A lot of departments put out written documents. Don't stop people unless you absolutely have to, because you don't want to have interaction with them, because the CDC is saying, stay away. And that has continued. And we'll talk about that, I think, in this slide here. So I really wanted to get this black line to pop out, but I couldn't figure out how to do it. I'm horrible at PowerPoint. The only crime, traffic safety crime, that the FBI collects data on is impaired driving arrests. They call them driving under the influence arrests. So I don't know how many of you are familiar with the UCR, the Uniform Crime Report, which is now translated into what's called NIBRS, the National Incident-Based Reporting System. It's a voluntary reporting system that law enforcement agencies engage in. I think a lot of people know what the UCR was. That's gone. And then they kind of combined UCR and NIBRS for historical data capture into this crime data reporter. So the red line, starting in 2010, is the number of impaired driving arrests or driving under the influence arrests that the FBI collected. That line is pretty scary. Starting in 2010, we started seeing decreases from 1.2, and if you look backwards from 2010, they were up around 1.5, 1.6 million prior to that, and they've steadily declined until COVID hit, and then they precipitously declined. And we had a little uptick, coming back, but we're not anywhere near what we were before. So, we're arresting half as many people now for driving under the influence, and most of the sessions I went to were about impaired driving. We have great training. It's a little technical for law enforcement officers, and we have a good drug-impaired driving training, DREs and ARIDE trained officers that can recognize drug use. Now, this is scary for me because I'm trying to get more and more law enforcement officers to take this training and to arrest impaired drivers. And, I think if you looked at lines across other criminal offenses, you see something similar, and case clearance rates declining. And then you look at, the impaired driving fatality numbers, which is the black line. Now, there's a correlation here, but correlation's not causation. So there's a lot of other issues that go into that black line other than just these massive declines in impaired driving arrests. But it's pretty scary. So, this speaks to a bigger issue, I think. And I've heard it at a lot of the sessions, even at the plenary session on Sunday morning, that, law enforcement's really struggling. Colonel Packard, I know him quite well, he's way down. Recruitment and retention is the single biggest issue for law enforcement administrators today. You can't get people. I live in the county where I work, Anne Arundel County, down about 250 officers. That's a pretty common story for larger departments. And every single squad car I see now riding around the neighborhood has a poster on it for recruiting with a $20,000 signing bonus if you get accepted, So it's really desperate. And, people aren't applying for these jobs, so you're kind of hiring on the margins, right? I remember when I went through way, way, way back in historical America and got hired, there was like 3,000 people that applied for 20 jobs. I was fortunate enough to get one. But now, they can't make their recruiting quotas, and it's tough. So when you're hiring at people that make the minimum qualifications, right? But when you had 3,000 people, you didn't have to worry about minimum qualifications. You were getting people that were way over that bar. So it's sort of like this self-aggravating spiral that we're in, I think. And law enforcement needs help. And the NRSS recognizes that law enforcement is a key component of pushing us back towards zero. And I think that's important as you talk about policy and law enforcement. So I'll stop there with that and just tell you a little bit about the division. So, we work nationally with most of the national players to help them effectuate policy that will be helpful to our mission. So we've been around for a long time, and this slide's pretty old. This slide was made about 5 years ago, and I threw it in here because right in the middle there it says policy, which was very appropriate for this workshop. So we do try to help states, law enforcement agencies, local jurisdictions initiate and perpetuate policies that will help reduce crashes. And we give practical, information, training, and technical assistance to the states. This is who we work with. This is a partial list. That's all I could fit on the slide. It's kind of an old slide, but we work with all these entities. In my shop, at the state level, they're working more with their state chiefs or local agencies, but we work nationally to help these organizations set policies that will help stimulate traffic enforcement activities. So we've been around 20 plus years. We support the criminal justice system. We collaborate, big thing. I heard that at all these workshops, communication, collaboration, working with your partners to try to push traffic safety forward. And we have a lot of legislative mandates. We work with technical assistance and training, SFSTs. I got 5 minutes left. I'm moving on, Shashi. So looking ahead, what the division is going to do, we do training, the SFST, DRE, ARIDE, that's all out of my shop. Speed measuring devices, those kind of things. We coordinate with the federal partners, and it's weird that driver education lives with me. little separate from law enforcement, but we do a lot in driver's education. That's too big to talk about today. So I did want to talk about equity and equality. Everybody's seen that little, I always have in my mind the picture of the guys at the fence with the crates. And, you know, it's really easy to conceptualize. 3 guys, 1 short, 1 medium, 1 tall, and, you know, they mix the crates up. So equality, they all get 1 crate. Equity, they get the crates that are appropriate so they can see over the fence and see the ball game. That is so easy to conceptualize, right? Perfectly clear. But how do you translate that into a law enforcement community that's really complicated? And they do a lot more than just traffic. There's all kinds of issues that the law enforcement community deals with in communities. So, you know, for equity, and what I'll leave you with is, it's not well understood. I talk to chiefs, colonels, high-ranking people all the time. It's like, how do I know if I'm being successful at this? Well, I'm not getting any complaints. Is that good? Well, no, probably not. That's not a good measure of success. But they just don't understand it. They have this voracious appetite of how do I know at the end of the day, the end of the month, the end of the year, that I did well for my community in terms of equity. And it's sort of amorphous for them right now, and we're trying to help them understand that, at least in terms of traffic law enforcement. And the group of folks on that slide I showed you, they're trying too. I think we'll get there, and I think we're going to figure this out because America's smart, and they will figure this out. So these are some of the things we're doing. We're looking at a new model that's community-based, and we'll use a bunch of different data sources rather than just crash data and things, and it's very community-focused. These are all not working yet. They're pre-award, but this is generally what we're looking at. So I think this model, this enforcement and deployment model, will work well. We're looking for equitable processes in traffic fines and penalties. You know, if you look at European models and some other countries, you know, they can see your social economic status pretty easily because they're very socialized. Here it's really hard. But it's not fair to people to be fined the same as a, you know, mid-income person as a person that doesn't have those kind of assets. But you still have to deter them from doing risky things again. So there's some models out there we can look at to figure out how we can adjudicate traffic offenses equitably. So that's a really good one. I think that will help in understanding how I'm doing well with equity. Traffic stop data collection, you know, Connecticut, I got 3 minutes. Connecticut is doing a good job. We need to figure that out. We need some noteworthy practices to help folks understand data collection and how to evaluate that and let the public know they're doing well. We're looking at feasibilities for alternatives to conventional traffic citations. There was a big push for that. We're going to look at that, see if there's certain things, certain areas in traffic enforcement where we can do that. And we're going to do impaired driving training, the SFSTs and DRE, all that curricula. We're going to do that in Spanish, so I think that will be helpful. We have a new law enforcement liaison program. It's a study. This time we're going to evaluate it. There's going to be an academy associated with it, so that we may be able to get an association together. This LELs really help us, you know, facilitate communication and doing high visibility enforcement activities throughout the year for us. We're looking at innovative approaches to speeding enforcement, and all this is to help assist in carrying out policy. We have this new course on that. We have a really good relationship with DOJ cops. Hopefully some of you will look at this. This is for people with intellectual and developmental disabilities at traffic interactions. Might not be in a car, could be, you know, pedestrian, but it's helping law enforcement understand how to deal with this cross-section of the community that's available. These are some resources. You've all seen these before. I did want to highlight the speed safety camera program planning operational guidelines that just came out. There seems to be a change in the wind across the nation to accept speed safety cameras a little bit more. These work very well. They're a proven safety countermeasure. FHWA has tons of research, and NHTSA has research on these as well. These work. If they're implemented correctly, these are going to slow people down in places where they ought to be slowing down. So they work very well. That's all I have for you today. I made it, Shashi? Just in time? You want me to stay here for, are we all coming up here now? Yes. Okay, excellent. Thank you all. It was a pleasure to see you. Thanks for staying, and it's good to see you all.
We have a few minutes for questions to Keith first, and then we will go to the panel. Are these yours?
Yes, sir. Thank you.
I saw a hand up there did I see somebody with a hand?
No hands? No questions?
Good morning. Bob Thompson of the Washington Traffic Safety Commission, and I have a question for NHTSA, and it's one that we kick around in our state all the time. I'm trying to find some information. I know there was a study at Stanford in 2001 or 2003, somewhere around in there, about the effectiveness of enforcement versus warnings, and how that plays into the role of, actual enforcement and getting people to change behavior. So I'm wondering if there's something out there that somebody else knows about, because that's the only ones that I've been able to find out and from my contacts.
Yeah, there hasn't been a lot of studies on that. I have it I have a strategic plan, and I have that included to look at that research. But, we have to prioritize. None of the HVE studies looked at a warning versus a citation. But I did, we have this one, alternatives to citations, but I don't know that we want to include warnings there. We're looking at more social public health alternatives to help people, stop making risky decisions. So, good question. There's not a lot of information on it.
Good morning, Emily Kleinfelter, Denver Regional Council of Governments. I was wondering if you could speak a little bit about, you had an example there when you're talking about equity and other types of citations and fines. I know that restorative justice has been something that New York has been working on when it comes to traffic violations, and I was hoping you could maybe speak to that, if there's any research or any advocacy around looking into more restorative justice techniques for people committing traffic violations.
Yeah, so as the project I just put up there's some of those around the country. We always start with literature reviews, see what's going on, see what the state of the practice is now, and then use those to develop some noteworthy practices to do restorative justice type sub-strategies and implementations at the state, local level. 18,000 agencies out there in the cities. America's so complicated because it's federalism is there. People have their own governments. The cities have governments. The counties have governments. There's not a lot of unincorporated area in the United States. So, you have to make that work across all of those jurisdictions. So, what happens in one court is a little different than happens in another court. But that's an adjudication processes, right? So we're working on that. Society is demanding of us to change. We have to evolve, and there has to be new ways to do things that will help people. That's why we're all here. We don't want people to be hurt and injured in traffic crashes. There's a million other things out there that people get hurt and injured doing, and same types of issues sort of plague them as well. But yeah, we're going to change. We're going to figure this out. I have no doubt we'll figure this out.
I saw a hand up there. Yeah.
Hi, Chris Gonzalez. I'm from El Paso County, Colorado. My question is kind of both, because Dr. Pressley referenced it in her speech as well. For my agency, we're struggling to decide what best HVE program to put together, whether it's a surge type, short periods, a seasonal click it or ticket like Dr. Pressley mentioned, the dramatic drop, or a constant year-round HVE program. And I was wondering if either of you, or particularly NHTSA, has seen any differences in the application of HVE programs as to whether or not it creates a sustained reduction, or if it's always we're in your face and it causes an immediate reduction and then subsides after it's done.
Take it away, Joyce. I've been talking too much.
I'm not sure I have an answer for that, but I can tell you that we looked at a lot of issues around the enforcement and the enforcement periods that I didn't present today. And one of the things that we saw is that there was sometimes a real pop-up in injurious crashes after the high-ticket visibility program, because the jurisdictions had spent down their enforcement funds and were short on enforcement funds and so I didn't present the financial side of this today, but for lack of time. But it is much more complex. I know in New York City, we have someone named Kim Wally-Schwartz who works with the Vision Zero program out of the mayor's office, and she is big on education, and she is less big on the enforcement side. So she and I are good friends, but we go back and forth about, I'm a proponent of enforcement decreases injury and very serious injury. And she's like, you know, we should be educating. But on the other hand, we have people in New York State that get 50 citations for speeding inside the Manhattan and inside the city limits. And they just go across to New Jersey and get a driver's license and register their car over there to avoid the fines. So it is a complex issue, as Keith talked about here, and it's not easily settled in a 1-hour session.
Keith, do you have any follow-up?
Well, there is some research that show, and the congressional requirement, they don't make those decisions if it's not based in some kind of research or information that supports it. They're looking for year-round enforcement of impaired driving, occupant protection, and speeding laws. They went on those 3. But yeah, I think there's enough information out there to know that, if you can do enforcement continuously and then supplement that with the HVE activities, that's more effective than just, having a big decline in your traffic enforcement efforts during the year, except at the high mobilization times, at, Memorial Day, Labor Day, and during the holidays. So, yeah, I think there's sufficient information that I can say reliably that, yes, having a good, consistent traffic enforcement presence in your community and then doing the HVEs is better than just doing the HVEs.
If I could pick up on, go ahead.
Just the one thing we haven't really touched on much is the automated enforcement with the camera enforcements. And we're starting to see that and do it a lot more in New York State. And that gets around some of the equity issues of enforcement so that it's blinded with the automatic enforcement. We're also seeing people putting out blue lights where there's no enforcement, but people can see them on the interstate for a great distance, and looking at that as a way to control speeding and some of the other dangerous and risky driving behaviors.
If I could pick up on that comment, Keith mentioned there are about 17,000 law enforcement agencies across the nation involved in traffic enforcement. But one disparity to notice is that 20% of these agencies are in 80% of, have 80% of the officers.
Correct.
Right? So when you look at rural areas, if you look at their jurisdictions or the extent of coverage they need to provide, either center line miles or lane miles of road, it's far greater per officer, if you will. So how do you deploy the resources? It comes back to the cost and economics part of it. Yes, there are areas where you have higher levels of activity. So there are disparities between the extent of area in terms of square miles, lane miles, or center line miles, and the function classes of roads versus the staff available and the time available. You may have certain pockets where you have historically higher risks exhibited by motorists, so you may want to have a higher deployment there. But there's no one magic equation or solution that would drive, okay, here's how to allocate. At least I'm not aware of that. Each community has to work with what might not just be from a scientific basis, what would also be politically acceptable, societally embraceable. More questions, comments?
Yes, hi. Good morning. Good morning, friends. So 25
Would you please
years-
identify yourself?
I beg pardon?
Please identify yourself.
Yes, Ed Hutchison. I work with Cruise, formerly with Lyft for about 5 years, and 20 years with the National Sheriff's Association as a traffic safety director. And my tenure with Lyft, I would go to that. We did some studies with the National District Attorneys Association, and this is really for those high-risk folks that we were talking about, that willfully, flout the laws or what have you. And we also see that some attorneys general are saying, because of the lack of law enforcement, these are laws that we're not going to enforce any longer. And we know that traffic safety is suffering because of that. The studies that we did looked at the individuals who were both taking those vehicles, taking the ride share, instead of like impaired driving, we really focused on impaired driving. And we looked in California, 3 cities. We looked in Chicago, Fort Worth, Atlanta, Massachusetts. And what we saw was a 37% reduction overall in impaired driving events. So that's arrests, it's fatalities, crashes, that kind of thing. We use FARS data and some of the data that you presented up here. And I guess to get to my question is, that demographic that we looked at, 18 to 35, we know that's the highest risk of individuals that are affected by these, by breaking those laws or flouting those laws, let's say. But they're also that same demographic that are using rideshare. Is there a way that law enforcement or the private sector or the public sector can work together to build those countermeasures that are effective for those individuals that are really the highest impact of those fatalities and crashes? Long-winded question, I know.
Well, hi, it's good to see you.
So good to see you.
Yeah, public-private partnerships are massively important. When the private sector can work well with the government, and that's sort of like the perfect storm of addressing those issues. So yeah, how we do that really happens more at the local, state level than at the national level. It's be hard for us where I sit to, stimulate a bunch of local private-public partnerships. But yeah, it's a great example, and that use of the ride share is a great example of how those public-private partnerships can be successful.
We're seeing some jurisdictions that are using vouchers on the ride-share programs to cut down on impairment as well, so that it discourages people and encourages them to use ride-share rather than to drive impaired.
Anything else? While you think about questions, I forgot to acknowledge a few people. We have Eva from the Colorado Department of Transportation who's helping us with the session. And I also wanted to acknowledge Tim Kearns from the Maryland Highway Safety Office and Dorothy Cummins from the Louisiana Highway Safety Commission, who are the overall track leaders for this. So they were the ones who helped come up with these individual workshops and sessions. So I want to acknowledge their roles as well. Back to discussions, comments, questions.
I have one comment. Looking at Keith's great report of 7 quarters of declining fatalities since the COVID epidemic or pandemic now. The stuff that I presented goes back and it compares it to pre-COVID, and the NHTSA reports compare 1 year to the previous year, which is extremely helpful to see if we're going in the right direction. But it's confusing to some people when they see these different numbers, but most of the time the different numbers are related to the comparison year. So ours is looking at what changed between the baseline of 2019 and 2021, and to see what predicts that margin of difference, so that increased fatality rates. And one thing in New York is that our state police's primary job is to do traffic enforcement. So we saw them bounce back up pretty quickly during the COVID pandemic. But our local police had to deal with violence and a lot of other issues. So they, that also increased during the COVID era. So they had a lot more to do. They also deployed them to handle some of the COVID vaccination sites and other things, so that there's a lot of complexity here.